And welcome to our live conversation as we mark the third anniversary of the COVID pandemic. The pandemic has touched almost every area of our lives. More than 1.1 million people here in the U.S. died, and thousands more are dealing with long-term COVID health effects. On March 13th, here in the tri-state, much of our normal life just stopped. Schools closed. Many people began working from home. Weddings were canceled, and that was really just the beginning. The shutdown was profoundly strange, and it had this lasting effect on our national mental health. But the pandemic also spurred some amazing science, and those achievements led us to where we are today. Joining us live right now is Dr. Matthew Harris. He's the head of Northwell Health's COVID-19 vaccine program, medical director for Northwell Crisis Management and Emergency Preparedness, and a pediatric emergency medicine physician. Now, do remember, we want to hear from you for the next half hour. We will answer your questions or air your comments, so you can submit them now under the live stream of this show. So, Dr. Harris, obviously we're in a very different situation today than we were, 3 years ago, but it's almost as if, there's been such a weird time. It's hard to tell time anymore.
Yeah, I mean, I think it's quite dramatic as saying it's night and day. I mean, I remember those early, very dark hours where, 800 some odd New Yorkers were dying every single day, where it really quite certainly felt like the end of the world. And fast forward, a few months to the resiliency of the United States to develop vaccines with international partners, to develop a public health infrastructure that really has not had to stand up to a challenge like this in the last 100 years. And to come this far, despite some bumps in the road, I think is a real testament to the public's resiliency, the dedication of the scientific and medical world. And I think it's really just an incredible thing to reflect back upon. Some very, very dark times and some really, really important shining lights all the way through.
Yeah, because right now, most people have resumed, a normal life thanks to, both a wall of immunity from either infections or vaccinations.
Yeah, I think it's something that, my wife and I have reflected upon as well, seeing our children go to birthday parties, which, still takes me a moment to step back and say this is okay, right? I think that a lot of us have some PTSD from the early days of the pandemic, both as a prior patient with COVID, as someone who's taken care of, thousands of children with COVID and some adults with COVID as well. I think that we have to take a deep breath for the first time and feel comfortable doing so. That doesn't mean we should let down our guard. COVID is still very much out there, but I think now we have more tools to deal with it. Our diagnostic capabilities are an incredible testament to how far we've come. And I think now we know that we can, for the most part, go back to the way the world was before. I think most people are probably paying more attention to the person coughing next to them, maybe washing their hands more frequently, wearing masks in certain situations. I recently was on an airplane and I chose to wear a mask, and that's fine. And others chose not to, and that's probably fine as well. So I think right now it's about achieving that level of comfort back in a point in society where I think we can do so.
And I really just want to, pause for a second to celebrate the science side of this. Humans unlock the virus's genetic code. They rapidly developed these vaccines and, mathematically built models so we could track and figure out worst case scenarios. And, for your, part in all of this as well, in addition to, obviously treating patients, but this vaccine rollout to get so many people vaccinated, as quickly and expeditiously as possible.
Right. It's pretty incredible to think that we've administered throughout the world several billion doses of these vaccines. It's really quite a number that's sort of unfathomable, especially considering where we were in March of 2020, where again thousands of people were dying every single day, and those are the ones that we sort of know for sure were from COVID. I think that one of the things that we looked back upon is how dark those hours were, but I think how people hampered down. They adjusted to life. We all learned how to teach our children from home, to work from home. But I think we also have to recognize the longstanding health impacts of COVID, of long COVID. I think one of the messages we're going to have to reflect back upon is how the scientific and medical community will have to work to regain the trust of the public, because I do think there were some bumps in the road along the way. And I think that one thing that's for sure is that the vaccines changed the nature of the pandemic. Good, bad, or indifferent, I think we know for sure we would not be where we are today without those vaccines and the other novel therapeutics that came to be in very short order.
And I do think it's interesting, too, how many of us, myself included, all of a sudden became interested in science and in, herd immunity, and different variations of a genetic, mutation of a virus. And all of a sudden, people are having these conversations that we've never had, before. But for you, someone who studied it, what was that like?
I think that the majority of Americans can harken back to probably seventh or eighth grade science, where we learned about the scientific process, about developing a hypothesis, testing that hypothesis, proving it to be true, and then validating it with a second study, right? And we live that, right? I think that this is where perhaps the messaging went somewhat awry. This wasn't a large scientific experiment. It was using science to drive our response to something that was, prior to 2019, unthinkable since 100 years ago. Right? This is something that we really have never had to do in a meaningful way before. But the science, I think I get the hairs on my arms are standing up a little bit talking about this, that we really were able to use science to drive our response. And again, I think messaging is something we're going to have to work on, both in the private and public sectors, and that partnership together, because I do think that where we did see some influence of politics on health messaging, and I'm hoping that we can move past that moving forward. But I do think that to live through this, and I don't use that word lightly, right? There are many who did not live through this. So to have had COVID, to live through this is amazing. And I'll end with an anecdote that my son recently told me, that my first COVID vaccine was on my birthday. It was January 8th of 2020, almost 9 months the date after I was hospitalized for COVID. And my son asked me why I was smiling in my picture when I got the vaccine. And I said, because I thought I was going to die in that hospital. So to have 9 months later this amazing optimism circulating through the room was just touching.
Right. You think back to that hope, to the mass vaccination tents that were set up and people all trying to log on and figure out, how to get an appointment. It's like when you're standing where we are now and you reflect back on just that overwhelming fear.
Right. I do think that one of the things, I guess one of the main positive things that's come out of this is we've now developed infrastructure. I think if you jump forward to monkeypox, we were very, very robustly able to launch that response for testing, treatment options, identifying those who are at risk, providing the appropriate medical care and interventions because of the lessons we learned. So I think now both the private sector and the public sector, and that partnership that exists between them, for whatever comes next, I think we're in a much better place than we were before. If that is a silver lining, I'm willing to take it at this point.
And also globally, I mean, obviously we had cooperations between different health systems here in the US, but then you saw like this global health cooperation.
Yeah, I think that certainly we should recognize that there were countries, typically countries of low socioeconomic status, that were late to receive vaccines. And I think that's an inequity that we're going to have to live with, that we're going to have to learn from moving forward. But I do think that what we did see was major players from around the world, including the United States, recognizing that we need to get vaccines out to the entire world. Right? This is a pandemic that spread like wildfire from most likely from Wuhan, China, out to the rest of the world in a matter of days. So I think this is something that we have to recognize as a global phenomenon. Our response has to be global, and this is really where our partnership with other countries is so crucial.
And what about long COVID? There are so many, people out there still suffering with health effects from, their infection.
I think long COVID is going to be one of these things we continue to study. I think one thing, we mentioned the scientific process before, is our knowledge of COVID grew exponentially and rapidly in those first couple months and years of the pandemic. And now as we move towards a more endemic phase, I think we have to understand the more longer term effects, both of primary COVID infection, and many people have had long-term sequelae just of the primary COVID infection. Long COVID itself, I think, is something that will be followed. There are several centers around the country now that are doing important bench research and clinical research about this. And I think this is probably the chapter that's not fully written yet.
And what about this idea of being endemic?
This is an important topic. I think as we discussed earlier, the Johns Hopkins Institute is now taking down their vaccine dashboard. That is not the official end of the pandemic by any means, but I think it is certainly a sign that we're going to continue to track this virus as we would any other, and we need to continue to move more towards normalcy.
All right. Thank you so much, Dr. Harris. Up next, our conversation continues, and we're going to go in depth about the way the pandemic changed the way that we work. We're also going to take a closer look at its effect on education and our mental health. You can submit your questions or comments on social media right now. Just a final thought. I'm wondering, we're on Facebook right now, but I'm just wondering, having gone through this winter when it was so bad with, RSV, and we had so many cases of the flu at the same time, there was still, COVID in there. What was it like for the hospitals to have to ramp up in such a way again?
Yeah, I think that it certainly was an emotional response. I think fortunately for society, this was mostly a pediatric problem. So if you look around the country, RSV and flu and now human metapneumovirus, adenovirus has disproportionately affected children, as most viruses do. So I think that especially for the pediatricians and emergency medicine docs, this was really a moment to think back about those chaotic days. Though again, we now have a more organized command structure, right? We were able to look and say ahead of time, let's follow the data. We have projections now of what's happening with RSV and flu. We can think about how many more beds we need. How do we get more ventilators? So it wasn't the fire alarm that I think the first months of the pandemic were. And I think that if we've learned any lessons over the past year, it's that we need to take the infrastructure that we built during COVID and now apply it hopefully in smaller numbers to things like RSV, flu, strep, these other things that have popped up over the past couple of months. This won't be our last battle, but I think we hopefully have now learned those lessons the hard way. We're, grossly unprepared for what 2019, 2020 were to bring us. But I think the resiliency, not just in my health system in Northwell, but I think lessons learned around the world are guiding our response.
And obviously, you all lived it, and we're there for it. But for the doctors and other healthcare workers who are coming up, do you think the way that they're trained changes now, so that you impart that knowledge, or schools are changing, what they're teaching?
Yeah, I mean, I can tell you, and I'll speak only to Northwell's experience, but I've had some colleagues around the country, University of Colorado, and some other places that are doing this. It is now every clinician, nurse, paramedic, neurosurgeon, everybody in between, it's now their responsibility to understand their role in an emergency setting, right? Because I think we all know what to do if there's a big bus accident. What happens when that bus accident lasts for 9 months, right? So I think now it's understanding how you get community pediatricians in to take care of sick kids. How do we use that dimmer switch to turn on and turn off resources as we need them, but also maintain breast cancer screening and maintain routine visits? Because I think everything shut down so quickly because we had to. I think the next time we'll know, we're just going to turn on virtual, right? There's no more snow days, right? So there's also no more reason to miss those continuity visits.
Thank you so much, Matt. I appreciate your time. You are officially done today.
All right, we'll talk soon. Be well. Thanks, everybody. Be safe. Bye-bye.
Be safe. That's true. No, I did not tell him.
I'm Nicholas Froney. I'm a high school history teacher in New Jersey. The pandemic was definitely a testing point for me, and I think for most educators. Literally overnight, we had to do something we were not prepared to do, we weren't resourced to do, and we weren't trained to do. But we somehow made it work. It wasn't as effective as being in the classroom. And I think if I got anything from the pandemic, it just made me realize how important the relationships are that we establish with our students in the classroom. How it's so much easier to engage them and connect with them and inspire them. We did see, as educators, a lot of regress when students came back in the classroom. But it was inspiring because they're so resilient. So many of them bounced right back. Others struggled because they were conditioned for a few years to be on their phones, to be alone, to not interact. So I could still see that with students in my classroom now. But it was something that made me not only appreciate educators, but appreciate what matters most in education. And that's those moments and those connections and those relationships that we can have in person with our students. There's no replacement for in-person teaching. But somehow teachers found ways to be as effective as we could in the whole virtual teaching setup.
Welcome back to our live conversation as we mark the third anniversary of the COVID pandemic, including its effect on work and our economy.
There's some structural changes around work that's happened to the pandemic. The first one, obviously, is the growth of remote and hybrid work. It's obviously hybrid work's here to stay. workers where they don't need to will not be coming back to the office 5 days a week. It's also given us some other benefits that we've seen really in the last 12 to 18 months. We've started to care more about what does it mean to be a good inclusive leader, how to kind of bring everyone along, with a 62%, labor force participation. We need every worker, every skilled worker, every able worker to be kind of in the workforce. And the more that we can actually inspire and make sure that everyone's included, whether they are remote, hybrid, or in office, is going to be super important. Then I would just add the well-being factor. We don't talk about well-being enough in corporations, and I'm talking about mental health, physical health, financial health with kind of rising interest rates and debt levels. The more businesses are now leaning into that to say if you're not happy in your kind of mental and kind of physical well-being, you won't bring your best to work, and we need you to kind of help us transform the business and execute business as usual. So I'd say the hybrid work, the focus on leadership, and the resurgence of well-being as an important business and societal topic.
And what about for women?
Sadly, the pandemic is around the world, and especially in the US, because we didn't have childcare accommodations. We've seen so many women, caregivers, disproportionate women, sit on the sidelines. There's some green shoots. If you've seen Biden's CHIPS Act policy that basically says if you get funding for CHIPS Act, you'll have to kind of comply with giving mandatory childcare. That could be helpful. But the challenge is from a woman's perspective is access, the flexibility, but also some of the culture. We need to make sure that both women and male leaders are demonstrating some of those inclusive behaviors we talked about earlier.
So it's clear when we look at the pandemic and we look in the rearview mirror, lessons we've learned from the pandemic and as we go forward is exogenous shocks certainly disrupt the economy. And the pandemic was certainly one of those shocks. And when we get a shock, we learn about the weaknesses that may exist in our economy, such as our supply chain weaknesses, and in the US, in particular, the reliance on a global supply chain and the need to react to that. We've also experienced certain other structural changes, reshoring of manufacturing to some extent, an adjustment in retail operations. We relied heavily on bricks and mortar, but we were going through a transformation. The pandemic accelerated that transformation in the bricks and mortar space, transforming retail. The other thing that has been quite apparent is that fiscal policy and monetary policy is not easy. And that is something we experienced such stability in our economy for many years. The pandemic disrupted that stability. And a lesson we've learned, it's not easy. And the question becomes, what type errors are we willing to make in fiscal policy and monetary policy? At the end of the day, we need steady hands at the helm. Mm-hmm. And I will say, I think Chairman Powell has shown a great deal of intestinal fortitude during very volatile times with significant issues in the data itself. And that's something else we've learned. The data that we rely on and that we use for the rear view and try to remember the future or forecast what's going to come, there's errors in that data and it's imperfect. And those imperfections have led to a level of volatility and uncertainty, which as individuals and decision makers, we have to lean in and accept and not put our heads in the sand. The one thing I can say is the U.S. economy has shown amazing resiliency. The U.S. worker has shown amazing resiliency. Businesses, the same thing. We may experience cracks, but having a government that will function, and I think that's what we need to impress upon in general. And I know this is more political economy than just economy, but if we have a functioning government where people are listening to each other and making sound policy choices. We can disagree, but let's take the personalities out of it and focus on the real issues at hand.
Absolutely. All right, up next, the pandemic's effect on our mental health and the education of our kids. I hope you can stay with us. You're watching News 12. Sure. Hello to everybody on Facebook as we mark this 3-year anniversary of the pandemic and really take a look back at what happened, when they did obviously close schools and close so many businesses, and the effect that has had. So we're taking a look back at where we were, obviously talking to Dr. Matthew Harris and, what that was like in the healthcare sector. Obviously, we heard from Nick Ferroni there, who's a history teacher and education activist, about what it was like for teachers, who had never been trained on how to teach virtually, to all of a sudden jump into this world, whether it be, with kindergartners or first graders, or, for someone like Nick to try to teach AP history classes through a computer to teenagers. And then what that was like really in our houses as well, as people were trying to work from home while kids are on computers trying to do school from home, and we were all really just stuck at home. And then the impact that had on our workforce. We heard from Bhushan about how wellness has really entered the conversation, and also we're having conversations about our mental health, which we're going to tap into coming up in this next section. But to the economic portion of this, obviously we know about our small businesses. We're all living with the inflation that we have right now and the ramifications of that. Also taking a look at jobs and the unemployment rates, where they were 3 years ago as opposed to the job reports that we've been getting now, and really the lessons learned when it comes to economic resiliency and cooperation, some of the cracks that exist when it comes to the data that we rely on. We know it's imperfect. Some of those metrics have since been changed because of this. But really it illustrated for us, I think, also so much of a connection, and how much we all thrive on that connection to our community, to our schools, to our workers. So we're 15 seconds back right now. I appreciate you joining us today.
So, as we're approaching the 3-year anniversary of the COVID-19 pandemic, there's definitely been an absolute rise in mental health concerns, and we're seeing a great deal more anxiety about how things can go wrong on a large scale and create big change. Things, taking away privileges, our basic privileges, such as going to school, going out, socializing. Overall, with our children, teens, and young adults, I see a lot more fear and uncertainty. And as we're approaching the 3-year mark, those high levels of anxiety continue about things we can't control. Fear of the unknown, fear of another surprise attack, of something that will come in with a traumatic and sudden shutdown and drastic changes to our lifestyle. Things as basic as going to school, participating in religious activities, having family gatherings, and participating in activities. That's a fear that our children have, that it's going to be taken away again. And so how is it manifesting itself now that we're seeing what the long-term effect, the 3-year effect, seeing a lot of avoidance in our children and teens, avoidance of school, avoidance of social activities, socialization in general, or participating in things. There's high level of residual anxiety overall, where our children are coming into on a daily basis at a level 5 or 6, and then you add all the extra and additional stressors of the day, and they're coming in now at a higher level, and it's hard to bring that down and to manage it. Our children also have really high and unrealistic standards, trying to control things for them due to the fear of not having control over the bigger things. And so there's consistent frustration and disappointment of not being perfect and not being perfect enough and not producing perfection. And so, some good ways to help that we as parents can begin to moderate these heightened levels of anxiety are to engage our children in family time. It doesn't have to be for long periods of time, but using that as a place for emotional grounding and emotional foundation building.
All right. Obviously, we also know this had a massive effect on education. The data shows the impact it had in, kids being able to recovery. Families, so many of them still working towards that today. Let's listen to what one superintendent had to say.
For me, the number one lesson that came from the pandemic was the supreme importance of kids being in school in person. This is something that we totally took for granted until 2020. For many of us, that was the impetus, the big fight in the spring of 2020 to get our kids back in school as quickly as possible. And now we have the data to show that that fight was worthwhile, that the districts who did open up earlier in the fall of 2020, the students did recover better and are on a better path to recovery. But most importantly, the lesson from that is that our kids need to be in school because they need to be around their teachers. Those phenomenal relationships that they build with teachers are the key to learning. And when you look at Maslow's hierarchy of needs, that feeling of being safe, of having a strong connection with their teacher is so important. So these lessons are our kids need to be in school as much as possible, and they need to be around our teachers who are the experts who can help them best along the way.
I want to thank all of our experts who gave their perspective over the past 3 years. And I want to thank you all at home for joining us for the past 3 years and being part of some really important conversations around our health, our families, education, mental health. So many of you for so long have really been a part of what makes this show great. So I do appreciate you, and I hope you stay healthy.